Good afternoon, and welcome to a new episode of True Crime with Sarge. I'm your host, Joe Giacalone, and today we have with us Dr. Priya Banerjee, MD, forensic pathologist extraordinaire.
Oh, well, I don't know about the extraordinary. Thank you. That's
It's
not a
good to
new
see you again,
breed.
Priya.
Nice to
Good to
see
see you again. Yes, you humble as usual.
you.
So, we're going to get into, well, we actually had something already recorded for this, and then
Well,
things
yeah.
changed. Yeah, things kind of changed dramatically.
I think I want to say that yes and no. So I was thinking back, like on this week that I've commented on the Ellen Greenberg case, but it takes us back to where we were training in Lake Tobias. And, when you were presenting, oftentimes there was sort of a collegial back and forth with me complimenting, giving some input on cases and case management and the interplay of the police and the ME at the scene. And of course, that being held in Pennsylvania, this case came up before any other like new reports had come out. And I think we were still on the same page, and I think we'll get into that today. But I was really thinking that despite new information being released, we really have the same conclusion. And this week, why we re-recorded is I think I could, as more documents were made available to me, I really ascertained my opinion. It's stronger, and we'll get into that. And I really wanted to say that I've not flip-flopped. I think I'll say it was a homicide to start, in my opinion, and now I'm even more certain of that.
Right, and even the medical examiner, Dr. Osborne, did it. He thought it was a homicide from the beginning, only to change his mind, and then all of a sudden in court, he has now said, it's something other than suicide." Well, Doc, we're only dealing with five manners of death, right?
Correct. So, I mean, I think we have an experienced audience, but in case someone chimes in for the first time with an interest in this particular case, as a medical examiner, not the medical examiner on the case, but as a colleague, let's say, of the medical examiner or examiners who handled this case, there's cause of death and manner of death. So cause is why the person died, and the manner is the classification based on the investigation, outside information, in addition to the autopsy. So it's really, I always say we don't practice in a black box, right? Because you can have the same cause of death under different circumstances that would then classify it with different manners. So as we said, 5 manners: natural, suicide, accident, homicide, undetermined. And I don't, whatever that wording was, something other than suicide is not something I've ever written in any, either said primarily, so I'm repeating it here, or put it on any kind of document.
Yeah,
That's
I
not
mean that's actually the exact quote, something
right.
other than suicide.
That is not
Well,
verbiage I've ever used in court or anything official.
right. I mean, well, we know it's not natural. We know it's
Correct.
not accidental. So there's only three left. And basically, they've vacillated between all three, which I don't think I've ever seen before, right? We've gone from homicide to suicide to undetermined back to suicide to.
Right. This is a long-standing case, so and legally challenged by the Ellen's family. So I think that's why we've seen sort of the various reclassifications, if you will, or revisits to the case. Usually the caveat that I have at the end of an autopsy, and probably understood, is that if there's new information on any case, whether it be a case I'm reviewing or a case that I'm the primary pathologist on, I will happily revisit that case with new information, right? Because it could be, I mean, technology changes, confessions happen, we find new evidence, we make new connections, right? DNA's a new thing now, right? We're interconnecting different cases. I mean, whatever the new nexus or new evidence may be, is still, you can't just say, oh no, that's it, that was my opinion, done, right? Because I think that's being stubborn and myopic in a way. What you really need to do is say, well, at that time, this is the information I had, and now I have this information. However, it seems like there's not a lot of new information. It's just been sort of looking at the case again, maybe with some fresh eyes, like, because this was a different chief ME that looked at it this time and issued the 32-page report. But right. Yeah, it went from, I don't know if the first determination was homicide by the primary pathologist. I think
it was.
And then it went to suicide undetermined with more legal action. And then the most recent legal action was back to suicide without any new, I would say, forensic evidence.
Right. And in the last report, Dr. Lindsay Simon, medical examiner from Philadelphia, on October 10th, said the best classification as suicide. So
Right.
it's still, like, kind of worded kind of odd. It's not definitive as far as I'm concerned, which I think means she's open to if there's something else
Right.
that
I actually
comes out.
don't know Dr. Simon. I just want to put that out there. I trained in Philadelphia, or I went to med school there and trained there. But it's sitting very near and dear to my heart, but I don't have any connection to the ME office or Dr. Simon. So there's nothing personal. I don't actually know
Right.
him or her as a person, but I'm surprised they came to this conclusion. And in my mind, that's my professional opinion. That is not the appropriate classification.
Right. I mean, yes. I mean, I read the whole thing, and I have, there it is. I have some questions, right? I'm not going to ask you all these questions today, Priya, but I listen, from a former investigative standpoint, I always look at what the cops are doing, and then I try to match it up with the medical examiner did.
Correct.
And from my old days in working in the detective squad, you work hand in hand with the medical examiner, and whatever the medical examiner says is what you stick with. I mean, if you come back undetermined, it's up to you, the police, to give the medical examiner more information, right? Just walk us through quickly this undetermined.
I think it goes both ways, Joe. Just to clarify what you're saying, it's not a unilateral call, though, by the ME, right? Like, when I'm the ME, we have a banter back and forth when I work for Rhode Island and do part-time cases elsewhere, or even in my legal reviews of cases. Like, I can say, I agree with this primary ME or I don't, and it's often because I have either more of a holistic review of the case, if it's like the whole case file, or it can be a back and forth, like, I need you to go interview this person or revisit the scene or test XYZ gun, car, whatever it may be, and see what the results are, right? Because that could then add to it. So I think the collaborative approach is really what it comes down to. Now, at least for me, I'm not a softie. You're not going to just be able to put words in my mouth and say, I want you to rule it a suicide, because, yeah, that's not going to work, without definitive evidence. So to me, this case, when I'm faced with, like, let's get in the mind of a medical examiner, right? How do we choose a manner? When I'm faced with this sort of vacillation, or maybe, I would say, like, information that can go either way, like you're vacillating, deciding between two or more manners of death, usually two, undetermined is the right one. Okay. And so to smack dab call this suicide, even at the initial juncture, I think was a mistake. Okay. I think undetermined leaves it with some questions. And then I think that allows for more investigation, right? And you can see years later, the parents were just pushing for that as well. Like, that's, and then the ME also, I'm not just, and it's not that you cave to outside influences, because suicide can be a very inflammatory manner, in cultural terms. So I don't use it lightly, even when it is a true suicide. I mean, I have to explain to families, this is how I came to the conclusion. I'm not just labeling this without reason. But I think undetermined would have been right. And I think that would have probably sat better, given the irregularities in the case.
Right. I mean, I agree. I've even been on the record saying that I think it should have been undetermined from the get-go. And the reason that I said that, because to me, this entire case hinges on, for a lack of a better word, hinges on the latch, right?
The door.
I mean, to me, that is the deciding factor here, because they said that there was no disturbance of the snow on the veranda. They said that, there was no other, basically, looked like there was a sign of struggle anywhere else in the apartment. It all went down in the kitchen, no matter what happened. And that latch, and you have a neighbor that now has witnessed that the latch was in place, right? But you could still open the door, however, whatever it is, 2 inches or 3 inches.
Sure.
So this is, and for anybody that hasn't read the new document, it's
Mhm.
33 pages long, but there's a lot of, there's a lot of explanation in here. There's a lot of opinion in here too for
Oh,
a
definitely.
medical examiner's
Definitely. And
report.
I think that also to me is where there might be some overstepping in my mind. So if this was my case or any case where I'm dealing with what's called like a locked residence, and then you say, and then the latch was busted open, I'm going to leave that to the police to investigate. Like, I'm not a latch expert. I'm not a door expert.
Yeah.
I can only look at the scene and the body, but whether the residence is locked or not is a very important element. I mean, I'm always checking. I mean, we have that in our summaries. Like, my investigators knew to secure residence or unsecured residence, like my red flag goes up as soon as it's unsecured residence, in a big city, right? Like, I'm a city girl, grew up outside of DC, lived in Philly for 5 years, then in Baltimore for 5 years. I always lock my door, And so when you have a multi-tenant, this was an apartment building, in Manayunk, a suburb of Philly, like a busy suburb, then you have to lock your door, like you don't know who's going to access it. And so, but that sort of details with the latch, whether the integrity of the latch is intact, whether it could have been open, that's where like the investigation comes in.
Yeah. And that's, to me, that is the whole investigation, right? So
Correct.
was the story, I mean, there's different, and then it's actually included in the new report, right, where the fiance says that he went up with a security guard, but there's not really been corroborated. There's no video surveillance of them going up together. I mean, there's a lot of different issues that go there, but the whole thing is, if this thing is locked from the inside, there's no other answers that we have. I mean, it's as simple as
Right.
that.
Right.
If they can prove it 100%, and I don't think they've proved it either way, that it was secured or it was locked. I mean,
And,
we don't know.
in the report, even though it's quite voluminous, I did not see any reanalysis or further analysis of the door hinge.
No, nothing.
Or the door lock, excuse me. I keep calling it a hinge, but the door lock, the door period, the opened aspects of it. So
How about a reenactment? I mean, there's not even a
right,
reenactment
right.
about this,
So
like where you could
even
said,
though they revisit the issue, there's no new forensic data regarding the door or the scene, anything like that, or no electronic footage, like nothing separate from that.
right. Well, this is what I'd like to see. I mean, and we could still see it. You have, there's plenty of, I'm sure, hotels or apartment buildings that still have this old style
Mhm.
hinge lock. Let's reenact it. If somebody can actually engage it from the outside, right? Which would be theory
Sure.
number one, is that she's already dead inside the apartment, and the suspect latched it from outside, been able to do it, right? Is that possible? I don't know. We need a reenactment on this. Or was this done? Can you bust the door open and not rip it off the wall? Or just,
Sure.
I mean, these are tests that I think are pretty simple, that it should be done. And I don't care if it's the defense that does it or the Philadelphia Police Department. Somebody's got to do it.
Yeah, I mean, and that's interesting to me because, again, that, as you said, is a police driven investigation. I mean, given that the Emmy has been under so much scrutiny in this case, I don't know why that kind of follow up. I mean, this has been going on a long time, much further than I've even been familiar with the case.
Mhm.
The initial ruling and legal matters. Like, I don't even know the full history of the case, because I've just recently learned about it and really caught up to speed on most of it. But really, like, why in retrospect they can't go and try to recreate it. We've seen other trials where, and I mean, I've been involved in trials where they get the same right gun and bullet and they test fire, or the same
Yeah.
car and a dummy, like Karen Reed. I mean, there are, and that, as far as I know, the apartment building's still there.
Yeah, I've been there.
So,
And
okay.
yeah, I've been there. And actually, if you go to one of the real estate websites, I forget which one it is now, you can actually type in the address with the apartment number, and you could see what it looks like today, because
I see.
it was for rent, right? But Here's where the Philadelphia Police Department should just reenact this, and then
Right. So
let the
the
family.
availability is there to go. Sometimes we have structures that are knocked down, right? Like the Idaho.
Yeah. Well, this building was redone though. It was redone. I think it's under new management. But
Mhm,
that could have all changed. I don't know, but I'm
mhm.
sure somewhere in Philadelphia, this old style lock is somewhere.
Somewhere, yeah. There's a lot of
Right.
old buildings that.
Or here's an idea: go to Home Depot and buy a door set and set it up. I mean, this
Right.
could end the conversation,
Sure.
because if you can prove that you can kick in the door or push in the door and not rip this latch from the wall, then we're leaning more towards the suicide at that point. At
Mhm.
least you can then say, hey, listen, we did everything we could. Here's the evidence. Now here's the proof. I haven't seen any of this. But Serenity brings up a point. If you remember when we did our pre-recording, I said to you, one of the things I focus on is the post-mortem interval, because to me the timeline is awfully short in some of these things. And
Correct. Yes.
let's talk quickly, because Serenity brought it up here. It's a good question, because I brought it up to you the first time around. Alga mortis, taking the temperature of the body, is that done in every case?
Um, I think a rough temperature is taken, at least in my history of scene investigation and experience. So we usually have a laser. Like, first of all, you look at the thermostat, right? Like, what is it set at?
It was 69 degrees. It was.
Sure. So ambient, close to ambient temperature. It is winter, so it's probably harder to keep an older building real toasty. But that's pretty comfortable. And then she's relatively thin. She's pretty thin. So she's gonna cool faster, her body, just because of like the nature of being less, having less fat as insulation. And then so we have thermometers that, I mean, we don't do liver temperatures or anything like TV. Okay. You can do like a surface temperature, but most of the time, what we do when I am on scene or my investigators, it's like a subjective, like warm to touch, cool to touch, room temperature to touch. You can get an idea of how long she's been laying there. And it's not going to be the same for her versus me, because I'm much heavier. Do you understand?
Right.
Like, even if I was under the same circumstances, same injuries, blood loss, we would just cool differently because of my body habitus is different.
Right. And how much clothes you have on.
Yeah, right. But I'm saying if everything else was the same still. Do you understand? Because I'm not 100 pounds. Yeah. So
Makes two of us.
but muscle mass, like whatever it is, right? So it's not so much the exact temperature as like, what are the post-mortem changes? Like how much rigor has set in? Is she warm, cold? Of course, remember, losing a volume of blood from your body also does relatively, decrease the muscle, like the mass, if you will, of the body, and what's keeping you warm, So I don't think it's as much a critical number as much as like just what postmortem changes are there. But I think the irregularities are much more than that. Her seated position, the statement that she fell onto the knife.
Yeah. How many of those? How many times have you ever seen someone fall on a knife?
Fall into
Multiple.
a knife, and then
Multiple times.
I have never seen that. I've had bodies with knives left in them. That is rare, but happens. So that's not the issue, right? That the weapon is left in. I've seen it in the chest. I've seen it in the abdomen, the neck. So it's happened in multiple areas of the body on different cases for me. The issue becomes, it's less common. Most stabbings, there's no weapon left in the body. We always x-ray the bodies to see if there's a piece of the knife left in.
Broken. Yeah.
Especially broken, especially if it hits bone somewhere, right? It can break off. And that can be really important in investigation. But to me, it's the injuries that were, in the back of the body that really are, to me, the medical irregularities in this case.
Yeah. We're definitely going to get into those. But so, for instance, in the postmortem interval, she is approximately dead 2 hours based on the timeline. So how do I figure that out? Well, it's right there in the report. So I find this a little hard to believe. At 6:33, they call 911. At 6:37, 6:35, the medics show up. Right. So 2 minutes. Listen, I've been to this place. You can't drive fast, especially, and we're
Well,
having a
and
big
remember,
snowstorm
it
to
was
boot.
winter and snow on the
Yeah.
ground too.
So
So
2 minutes. Well, were
right.
they just happen to be outside? Maybe, I don't know. I mean, were they sitting because there's like a cul-de-sac? Maybe they were just taking a break and they were already there. I don't know. But at 6:37, so the cops show up at 6:37. At 6:40, she's pronounced dead. So at 8:27, approximately, the medical legal investigator is doing his report. This is a separate report. And his post-mortem, so we have 2 hours. What kind of changes in the body do you think we would see? Generally, because we don't know. We weren't
Generally,
there.
right. So this is hard because she again is on the thinner side with lots of blood loss. But we would probably see rigor setting in. It's usually post-mortem 1 to 2 hours and some cooling of the body. Lividity should be blanchable at this point, but lividity is also going to be a lot less prominent when you lose blood volume.
Right. Could you
Right.
explain? Could you explain for the audience what blanching is?
Sure. So what I like to do in court is like you hold up your hand and you press on it. You can see maybe here that my hand became white and then it fills back in with blood. Okay. So when we go to a scene and someone is deceased, right from that moment, there's a gravity dependent settling of blood. And just like when you push on me initially, the reason mine fill in so quick or yours when we're living is because we have a beating heart and blood pressure. Blood is circulating. Since death, that's not happening. There's a slower sort of refill of the blood as it's pooling. But after time, after let's say 2 to 4 hours, what's happening is those red blood cells break down and really settle into the tissues. And you can't push it away anymore and create that white or blanching area. Okay.
Right. It becomes
It's going to be
fixed at
red.
that point.
Yeah,
Right?
it's going to be fixed and it's going to be like dark red to purple. Not as purple as your shirt, but like a reddish purple.
Still too early for that in this case,
Yes,
even if it's
right.
2 hours.
So we should see early changes such as blanching. But again, when all of that is secondary to having blood that's leaving the blood vessels into the tissues. If you have less blood left in the body, then you're going to have
Yes.
less liver as well.
Right. Now, according to the report, if I remember correctly, I think one of the stab wounds caused 120 milliliters of blood. Now, how much is that in regards to? Is that a lot of blood?
Well, if I recall correctly, that's 120 milliliters of blood around the heart, correct?
Yes.
The sac around the heart. That is a different significance than 120 milliliters of blood within just the chest or abdomen. Okay. So the sac around the heart is called the pericardium. Okay. And this is like a thicker sac that the heart sits in, and it sort of like can have some motion, but this is sort of a protective layer, if you will. Okay. It contains the heart and sort of the first part of the aorta as it exits the heart. And what happens is there's usually a small amount of like straw colored fluid. And when I say small, like 5 to 10 milliliters, okay? Just think of it as almost like body lotion, okay? Or like grease. It's just enough for the heart to swish against the lining. The linings are smooth and it keeps the heart sort of, when it's pumping, like expanding and shrinking from pumping, it lubricates the outside, just keeps it smooth and nicely running without becoming irritated. Okay, because if it was dry, think about it, it becomes like sandpaper rubbing against two surfaces. Okay, now that casing or the bag around the heart, the pericardium, isn't stretchy. Okay, it's not a stretchy material, and so a stretchy tissue. So what happens is when it quickly gets filled with fluid, like, so you can have fluid from other reasons, infection, cancer. We're not going to talk about those. We're talking about trauma here. So blood accumulating within that space. So normally it's only 5 or 10 milliliters, and now I suddenly over seconds or a minute get 120. Right? This is now going to make this fixed sac really tight. Okay. And what that happens is the heart needs space to expand and contract to pump. And it's going to get harder for the heart to do so with that fluid around it. So that is a significant volume. We call that, like we call it hemoperitonia, pericardium, excuse me. hemo, the blood, and then pericardium, the pericardial sac. So within that space around the heart, we're saying there's blood in there, and that's abnormal.
All right, hold that thought. I just wanted to shout out quickly, Tara Lynn. Thank you very much for that super sticker. I really appreciate it. And Rabbi Mike just gifted 5 memberships. Thanks, Rabbi Mike. I really appreciate that. With all of that, what you just spoke about in the sac that's around the heart, would that affect the liver mortis?
That would actually be more significant in terms of her survivability. I think if there's blood loss outside of the body, within the cavities of the body, like large volume into the body or outside of the body, the scene is bloody. That's usually what affects liver mortis more.
Right. So I'm going to just read quickly here from what the medical legal investigator wrote about the post-mortem interval. So it says there are defects, of course, in the shirt consistent with the other. There are no defense wounds, which I want to talk about too. The body is mostly flaccid, right? So we know that rigor mortis still hasn't.
Right.
Right. The hands appear to be slightly stiff. The body is cool to the touch at the extremities and warm to the touch on the torso, front, and back. Lividity, and this is the question I have for you. Lividity is inconspicuous.
Sure.
So I know what inconspicuous means, right? You really can't see it, but should we have seen anything? Because according to this, he's not really seeing anything.
I think it's highly variable. First of all, if she's sitting up, it's only going to be in the gravity dependent, which means like the back of the legs, not the back. Do you follow that?
Right.
And then, or slump. They said slump, like in that sort of vertical or diagonal position. It's gravity, so it's going to be pulled to only the parts that are lowest. I think the temperature and the stiffening are consistent. You know, you think the skinny arms and legs will get cooler rather than the body mass first. Do you follow that? And
right.
Stiffening can be in smaller muscles as well. But again, there were multiple stab wounds that caused blood loss as the mechanism of death. And so I think decreased lividity between the time frame and the blood loss, I don't think is unusual.
Right. Because the reason why, and I know you know why I'm focused on the post-mortem interval, is because there have been plenty of theories that she was dead before this,
Before he went to the gym.
Before he went to the gym,
yeah.
Right? And once again, from the investigative standpoint, this is what I always said, if I had hair, I'd pull it out. Because this is where, you as the investigators, if you make mistakes or you fail to do certain things, these are the kind of situations that you put yourself into now. Because
definitely you add variability or room for interpretation, if you will, right? These can only be evaluated right on the spot initially. That's it. It's a one-time shot.
You don't get a second chance to do it right, which I always say is cardinal rule number 2 in death investigations. And the first one is, treat every death as if it's suspicious until proven otherwise.
Correct.
Because to be in a position where you're in to basically have to say, you know what, we're going to go back to the crime scene now because the medical examiner says homicide, only to find out that it's been professionally cleaned. But you know what? You didn't just find out. You actually okayed it. So
right. You released the scene.
Right. And I didn't know that until I read the new report, because in the new report, it says that they were asked to have a cleaning by the property manager to have a professional cleaning crew, and that permission was granted, which to me, I find absolutely mind-boggling.
In apartment scenes that I've been in, and it's more characteristically apartments than single houses, they try to turn over apartments quick, because
I know. The body's still warm, and they're trying to get a new rental.
They're trying to get it clean, because for them it's just get it, less drama, get the drama out of there, re-rent, right? Release the re-rent, I should say, or rent out again to a new client, right? As soon as possible. Show the apartment, and
craziness,
so
right?
Like it didn't happen, and so we're dealing with that now.
Right. Just wanted to welcome, I'm assuming that's Pittsburgh Deb or Deb. Thanks for joining. And the 5 members that just came in, make sure you guys check out all your members only perks out there. There's some riddles, there's some things, and the test questions. There's lots of quiz questions. And you know what? I can guarantee you there's going to be quiz questions coming out of this interview that we're doing right now with Dr. Priya. So just be of mind, the liver mortis, the rigor mortis, the time frames. These are all good questions. So I mean, listen, the post-mortem interval, to me, I think there's some questions that have to be answered. And once again, it's from the
Well,
investigative
I
side.
don't even know if they have to be answered, but I don't think they can be
Well,
from
no longer.
this
Yeah, no
time
longer.
point. Right, correct. No longer can be.
Right. And then, this sounds like it's a defense of Dr. Simon, but it really is. I mean, she's kind of put behind the eight ball. She didn't do any of this stuff. She's
That's
trying to
right.
put this
That's right.
together. Right. She's trying to put this together from various other experts that had put input in this case. Videos, I guess she has, or pictures of the autopsy.
I mean,
Give
this
me,
is
how
very
difficult is this?
typical of what we do when we revisit any case, a cold case. When we talked about it at training and Lake Tobias, is that this is all you got. You have to work with the file, whether it's an inch thick or 2 boxes thick, right? And so it's not an enviable position to be in. And I'm playing armchair quarterback in a little bit, that I'm not the one in the hot seat like she was. I'm assuming it's a she, but
Yes. I'm assuming to Lindsay
yeah,
Simon.
I just don't know, but I think I would have had a different opinion.
Right. Well, she actually kind of says, we're going to get to that at the end, because 2 pages, I think, before her final determination, she's talking like in maybes. So, it's weird how it kind of ends up. But all right.
There's
So
some
they got the,
hedging going on.
right. So the toxicology report showed that she did have some drugs in her system that she was prescribed, but
Medication,
nothing. Yeah, medications, but
medication.
nothing to make her incapacitated.
Right.
So
And I
she
mean,
had, I think, Ambien,
right.
and was it, how do you say it? Clonopin?
Clonopin.
Clonopin.
Yep.
Which
So
was
those are very
given.
common. So Ambien for sleep, Clonopin's an anxiety medication. And we know from the history, she was under a lot of duress at work and stressed about grading and whatnot. So these are not unusual prescriptions for someone under sort of like an acute stress. They're usually given, and I am not a psychiatrist. I don't prescribe medication anymore. But, when I read medical records, these are common
Important.
medications. And it seemed like she was using them as prescribed.
Right. Yeah. It doesn't seem to be anything out of the ordinary.
Right. And
So
there's no overdose on these medications.
right. Which always brings up the point too, because when women decide to use suicide as their means of ending it, it kind of, she had these pills with her, but still chose this really violent method, which to me always like raises that red flag in so many different aspects.
Sure. And I mean, that's a rule of thumb. That's not usually an
Yeah,
absolute, if you will.
of course, yes.
But to me, whether it's a man, woman, whoever's found in this situation, anytime I have this much trauma to a body, my red flags up, and I always treat
Yes.
everything suspicious and then work my way down, right? There's always sort of a threshold, whether there's trauma or not, even drug overdoses, like, what's going on? Is the story add up? I'm always running through it in my mind as I do an autopsy. Do you understand? Like,
Right.
we go through the case, but I'm like, let me make sure everything adds up. Like they told me, this is how it supposedly went, and call me a cynic, but it's happened before where I'm like, this doesn't make any sense. I'm on the not so nice list of the police, and I'll try to edit out bad words, but,
Yeah.
and then we work through it. But the radar is always up, right? Like in terms of worrying and making sure that there's no hidden badness, as I like to tell my residents, like doctors in training, need to make sure there's no badness that we don't know of.
Right. Well, listen, back in my day, I had a great relationship with the Bronx medical examiner, and of course the New York City medical examiner too, because we were working all over the place. However, the Bronx District Attorney office probably didn't have a very good opinion of myself. So, but that's for another day. Trauma ICU RN, thank you very much for joining the channel. So, since you was segue right into those wounds, I have that. If anybody's following along, page 5 of this is where they start the wounds that she found. One thing I found interesting, Priya, is this: the medical examiner here, Dr. Simon, is listing a number of the wounds and giving the depth in centimeters and then also basically in inches. And then she stops. Uh, any reason why that, or just like, you forget? Because she starts off with that there's a 3 centimeter
Look at my
posterior
phone
neck.
just to make sure I have, I see
This is on page 5.
yeah.
Under,
So I don't know if it's just, hold on.
Yeah, it could be just strange, but I did it anyway. There's some, like on page 6, for those following around, she got the stab wound.
Right.
That's perforations of dura at the skull base and intracranial blood vessels. This thing is over 3 inches deep.
Yeah.
Jeez.
Now, the other thing we have to remember is that so there's 20. I want to talk about what a stab wound is. It like gives me cringe a little bit as a forensic
Yeah.
pathologist. So
Yes, sharp force injuries is the term.
right,
Correct.
sharp force injuries is a better way of saying it. So there's 20 or so sharp force injuries, okay? And why I make a big deal, I teach this, so I'm very stickler for verbiage and I want to be consistent, right? So this is a medical term, this is a medical definition, and I don't want it to be used incorrectly. And so a stab wound, so sharp force injuries are injuries caused by a sharp instrument, very typically a knife, okay, or a hunting knife, a kitchen knife, a scalpel, whatever. But let's not forget, it could be scissors, ice pick, I don't know, broken glass bottle can do it. I've had all these cases myself, so that's what I'm pulling from.
Yeah, anything sharp.
Anything sharp with a sharp edge, okay? Now, sticking with the knife, let's just say that a stab wound is deeper into the body than it is on the surface. Okay, so it's stabbing into the body very deeply. Then there's an alternative. It's comrade, which is the cutting wound or incised wound. So I use cutting wounds, but incised wound is fine, which means it's longer than it is deep. Okay. Now, what I like to say and point out is that the severity of each, those are purely definitional. It does not mean that a cutting wound cannot kill someone. Okay. And the perfect example that I give is if you slice my neck open from ear to ear, crossing the sides, this is going to, let's say, be 8 inches and it's 3 inches deep. You're still going to hit my blood vessels, trachea, maybe even my spinal column. Okay. So it does not infer any severity. Okay. But it just is a descriptor that needs to be accurately used. So 20 stab wounds is incorrect. It's 20 sharp force injuries.
Right. And I think one of them even says in here that the aorta was cut.
Correct. So
Now,
I mean, some of them are very severe.
Right. So on TV, when you hit the aorta, all the blood comes spurting out. But we don't see that in this case.
It wouldn't be the aorta as much as the carotid usually on the neck.
Right.
But any artery is going to have, if the heart's still beating, you're going to see that shooting out of blood because it's pressure. That's where your blood pressure is taken. It's pressurized blood.
But none of that we have no blood spatter in this thing.
We have blood spatter. We don't have pulsatile spatter.
Yeah, well, if they have, of course, they have the pool of blood.
Right.
Nothing in the sink. The sink is dry.
Sure.
The cabinets, had because where her head was.
There's smears.
Yeah, smears from where she could have just kind of slid down, kind of thing. But there's lots of questions remaining, like how can this not happen? And the lack of defense wounds is another thing and they talk about it in this case, in this report a lot. There's a lack. I think it's mentioned 3 times that there are no defense wounds.
A lack of defense wounds is, I would say, probably one of the strongest factors that would sway anybody towards suicide. Okay, because an able-bodied, alert female, even though she has those medications in her system, she's not drunk, she's not overdosing. That could be a normal person would fight back. Okay. Meaning she would be throwing her hands up, trying to protect her face, neck, whatever. That's a normal reflex. Okay. Even if you're not trained in any kind of karate fighting, it's just a normal, you're being attacked. It's a normal process. Okay. Now, my thought is you have to think about it. We're looking at the body in a snapshot of time, right? We're looking at her all together at once. There's no video. There's nothing else to say. Okay, we only know the last wound because the knife is still in there.
Right.
That's all we can say about any order of the wounds. Okay. Other than if any of the wounds have bleeding associated with them, that means she's alive when she sustained it, okay? There's a blood pressure and a heartbeat. Doesn't mean she's conscious, okay? But I can get into I can play devil's advocate, if you will, and why I'm very concerned about this case being called a suicide. If I look at it in a different way, a different order of the wounds, if you will.
Right. So, according to this here on page 7, it says that on the surface of the anterior or right side of the pons at the right middle cerebellar peduncle, I don't even know what that is, peduncle, is a superficial incised wound with hemorrhaging. This incision is best seen in the photos of the brain taken from formalin fixation. The hemorrhage visible in the incision indicates it was ante-mortem injury and not an artifact from the autopsy.
Correct.
Yes, well, so this happens before death.
So we are looking at the pons. So this is the pons is part of the brain stem, that reptilian brain, if you will, that's lower back of the skull into the neck, the upper neck. That's what keeps us alive, breathing, heartbeat without us thinking about it. That is essential to life, okay? The pons, medulla, that is what we call together, those are parts of the brain stem, okay? That is like, when we say reptilian brain, primitive brain, that is like what is needed to just be alive. And then we have our top of our brain that makes us human and more complex, okay? But heartbeat, blood pressure, vital respirations, right? Breathing, all of that is brainstem. We don't think, when I'm sitting here, I don't think about, oh, what is my heartbeat? Is it beating? You know, am I breathing while I'm talking? I'm not concentrating on it because that's automated. Any injury to that area is devastating. Okay. That is too critical for life. And the fact that we see a wound there with bleeding tells me it was when she was alive. Okay. And this is a very important distinction because, again, I teach this, I testify to this in court, my reports have it, which is any one of us can make an extraction artifact. Okay, we're using sharp instruments. You're going through bone to get rid of, opening the skull, opening the ribs. It happens, we're very careful, but no one's perfect. Okay, but I don't cause blood. I think when I slice through a brain, when I slice into the body at autopsy, I don't cause bruising. I don't cause bleeding, active bleeding. The person is dead. I don't cause bleeding within the brain. Okay, so
Right.
we very clearly tell that this is a true injury, not an artifact.
Right. And this is the reason why I bring this up, because my question for you, Doc,
Yeah.
is this the injury that many of the other experts are pointing to and saying that if this injury happens, basically she is, I guess the word they use is biomechanically unable to do anything else? Would it kind of like
Well,
paralyze you?
I think there's two wounds that I'm very concerned about with neurologic function. So one is the brainstem. I think that could kill her, like lose consciousness immediately. The other is the upper spinal cord, the C2, C3 region injury. Both of those to me, I think the biomechanical one for me is more the spinal cord. I think actually losing consciousness and vital respirations and function is the thank you is the brainstem. Okay, so like if you're shot in the head in the brainstem, or we see it sometimes injured in a whiplash injury in cars, where the neck is the only thing that's injured, falls, whatever the case may be. But even upper neck base brainstem, you can have like the pons being severed and you're dead. We don't actually see a lot of bleeding with it because it's almost like an instantaneous death. You don't get survival to bleed into injuries. And that's not uncommon from like a dislocation of the skull and the brain where the skull attaches to the spinal column. Like if you get such a big whiplash or neck injury, that can be immediately fatal. Like a dislocation, we call it, of the skull base. Now, I'm just going to segue into the higher region of the spinal cord.
Yeah, go ahead.
So I don't recall so there's diagrams that I've spoken about that I didn't generate, but were shown to me in other separate interviews this week on the same matter. And in those recreations, it was wounds N and T, Nancy and Thomas. So arbitrarily labeled as far as I'm concerned. But those wounds, I don't remember which one was the base of the skull and which one was the spinal cord.
Well, I can tell you right now, the stab wound end is the one I just described, of the anterior right side of the pons at the right middle cerebellar peduncle.
And then the other is T, which is the one to the upper spinal column. Correct?
Okay. That one I haven't found yet.
It was C2, C3 vertebral area.
All right. I haven't seen, I don't know. That one, it's got to be here somewhere, but you can continue whatever. I'll look for it.
Whatever the letter is, let's just talk about that region, okay? So when you have injury, so just to make sure everybody's on the same level, we have 7. Oh, that's so nice.
Thank you, Kristen. Thank you very much for that super.
That's a really sweet analogy. I'm a little bit flabbergasted. I'm like a lost for words. Thank you. I just describe things how I would teach it. So we have 7 cervical vertebrae. Okay, so we're talking that. So when we talk about C means cervical in the neck. Okay, and then 1 through 7. 1 is higher up where the skull, or it connects to the skull, and 7 going down. All the way at the base of the neck. So when we are talking about C1, like the skull is tightly adherent to C1, and between C1 and C2, 1 and 2, that's what allows our neck to do all this movement. And because there's ligaments that really secure it, that's why we don't injure our spinal cord. Okay, so we can move. All of these are designed to have basically like a bobblehead, if you will, right? Like a safe bobblehead. If we have trauma, then we're really bobbly, and then the spinal cord gets injured. Okay, so that's when I was talking about like the dislocation of the skull. Here, what's happened is not a dislocation, but between C2 and C3, so the second and third vertebrae, still very high up in the region at the base of the neck here, with critical functions. What's happening is there was a stab wound, and it's gone not only into the soft tissues of the neck, it's gone through the vertebrae into like where they described the spinal cord can be seen as bulging. Okay, so to me, that's really concerning. Okay, so, I'm going back to basic neurology. When we talk about innervations of the arms, so what nerves in the spinal cord allow us to move our arms? Nerves come out of both sides of the spinal cord at the C5, 6, 7 level. Okay, so a little bit lower than where this injury is, right? And that's what allows me to move my arms and do everything that I need to do, right? Now, remember, when we talk about level of paralysis, we always talk about where that level is. So paralysis is due to injury to the cord. So when neurologists talk about it, they talk about the vertebral level. Okay, so it's C. So here it'd be between C2 and C3. Okay, that's where the injury is. Everything below that is not going to work because you've basically cut off transmission of signals to and from the brain. This is basically like, now there's a separation, okay? Whether there's a physical separation or not, there's a lack of information that's going up and down, okay? So, and then in the spinal cord, this is like neurology 101, very basic, but you have motor, meaning function, and you have sensory, meaning sensation, okay? So these all run next to each other and then talk to the brain, and then the brain sends signals down and things are working when intact, okay? My concern is C2, C3, we've moved down past the brainstem. So in this particular injury, ignoring the one we just talked about, what's happening is this injury is above the arm levels, right? It's above 5, 6, and 7. So to me, if there's any cord compression, cord swelling, bulging, abnormality, even if it's not completely cut through, the cord is so sensitive, the spinal cord. We have you can add to my daughter's college fund if you want. She's only 11. But in any case, so when you follow basic neurology, if the injury is above this level, you're not going to have motor function or any function left in the arms. And that to me is the sentinel fact as to why she couldn't stab herself in the heart after sustaining this injury. Okay, now let's play devil's advocate, because I always do. There's no way we can look at all the wounds and say, just because they're labeled N and T doesn't mean that they happened
in that order.
In that order, right? So that is just a way to like sort of organize your thoughts when you're doing autopsy. And then T could have been the first one. Let's play devil's advocate. That was the first one. From the back into the, now she can't move her arms. Guess what she can't do?
Yeah, stab herself all those other times. Right.
She can't defend herself with her arms or her legs. So anything below that level is not going to work. Okay. And so, I'm playing devil's advocate, and I'm not omniscient. I can't tell you that this is what happened, but it made me pause and think this is significant injury to a critical area of the neck that would produce, quadriplegia, right? When you say someone is quadriplegic, it's because they've had a high neck injury. Now it's not to the area where they're breathing. They can survive that, but they're not going to have function of their arms or legs.
Yeah, which is the $1 million question here, right?
Correct.
I mean, that's the whole thing in a nutshell. Like I said, if you read this report, they do talk about that in several of the other people that I guess were hired by the family to talk about this.
Right. I want to clarify. I've never been hired by the family. I have my input is just out there. It has no impact.
Right.
I wasn't consulted for this review or ever with this case, So
this is a case that's going to be a textbook case. They're going to be teaching about this case for
sure.
forever.
I just wanted to be clear that there was no conflict of interest on my part. I'm just looking at this as an outsider reading the report and giving my own personal opinion on the matter.
Exactly. And here's my thing. Now, coming from, I've testified in court. You have an opportunity to say if you made a mistake on an initial report, right? It depends on when you got to own up to it, if you realize it or not. But I have to ask you a question here. It says, I think the entire first medical examiner's report is in question. When you miss 3 sharp force injuries and you miss not 1, not 10, but 20 bruises.
Yeah. I think it's sloppy work. So, when
you got to question the whole thing.
Yeah. And I'm pretty type A. If you know me, you know that I am
both of
very
us, yeah.
particular. Right. And that's what makes us good at our job. Like I'm always stressing out, making sure I didn't miss it. Even typos freak me out. Okay. Have I made them?
And there's several in here too.
Yeah, I have. I've made them and I still freak out about them. I'm not perfect, but what I testify in court is they'll be like, why did you comment on a 1/4-inch scrape on the knee when he was shot 10 times? Because my job is to document everything. Okay. Mm-hmm. Then I synthesize a conclusion, an opinion and conclusion, right? So am I going to put that as a significant injury in the conclusion? No. But let's say this guy shot and then falls to the curb and has some scrapes on his face and his knees, right? Because he can't stop his fall.
Right.
You can't ignore those. Those are injuries by definition on the body. And so I'm not clear why those were not really, to me, if I can see it, it needs to go in the report. Now, I might put miscellaneous other injuries. Do you understand? I might even put a little bit of characterization in them to say, hey, these aren't the lethal injuries, but they're there. So when there's a reader of the report and the photos are looked at, everything is accounted for.
Right. And some might say that the new report is very thorough, but there is something lacking in this report that I kind of question. And that is from the medical legal investigators report, the text messages that the fiance sent to his wife, to Ellen, the victim in this whole thing. They're not included in this at all. She included everything else but those, which, if right. And listen, if the audience hasn't read it, I'm just going to just briefly go through these. So the text messages start from 1732 hours, which is 5:32 to 5:54. Hello, open the door. What are you doing? I'm getting pissed. Hello, you better have an excuse. What the F? I have no idea. That was left out of her report, but she did include several other text messages in here that I find interesting because at 2:33 she made a phone call and she makes an upcoming dinner reservation for her and a friend that was supposed to happen, right? So
Right,
I
right.
say, well, if she was thinking about, doing herself in, why bother making the reservation
Yeah, I'm
for?
not gonna speculate on that. I have no
Yeah,
idea what goes through people's heads. That's
no,
more
I hear you.
asking like a forensic psych
Yeah,
question.
this is from the Yeah, this is from the
Right, it's
investigative standpoint.
investigation. My concern, as I said, it's really based on the autopsy findings as I've described, and I think the interpretation of them, and there's been some conflicting even descriptions of them in the report.
Right.
And I
But we
want to
do know.
also say that they didn't look at the spinal cord under the microscope, right? That the injury where there was bleeding at the brainstem or the spinal cord where they said it was possibly bulging, to see if there was any cell death or damage that we can see, not with just the naked eye, but under the microscope. And really, if you know about neuropathology, so the pathology of the central nervous system, microscopy is very key to that. Okay, whether it's a brain tumor diagnosis or a trauma diagnosis, because we can see changes, And so I would just think that that should have been done. I don't see any mention of it whatsoever.
Right, but they did mention there's no petechiae, right? There's no
Sure.
bruises.
But
No,
that's not looking at the injuries under the
right.
microscope.
That's for the strangulation part of it, though, where people say that she might have
Sure.
been strangled.
Right.
Strangled. They're saying that there's no petechiae, not in the eyes or the lips.
Correct.
The hyoid bone is intact, which generally means that somebody
Right. And
is
I
is
look at
broken.
this, I look at these factors in every case. Do you understand? Like I save the
Yeah.
hyoid in a jar. I describe it. There's certain things I'm so paranoid about that they're just part and parcel of every autopsy that I do. Obviously, if there's any trauma, it needs to be mentioned. But I think the mechanism is solely the sharp force injuries. It's who did them, and the order will never be known in terms of the exact order in which they were sustained, and these are the sort of issues at hand. But I think
Right.
ignoring the deeper injuries are very, very concerning.
And just on the last couple of minutes that we have here, because I'm so glad we did this in person instead of doing the. Only a 10-minute video, folks, and here we are an hour into this, and
Yeah.
we could do this for another hour, but we
Hey, you're
won't.
lucky my Ravens are on a bye week.
But we won't. uh, so yeah, like I said, I mean, this report kind of eliminates the strangulation part of it, but
Correct.
the other issue that comes down to is what it doesn't do for me, as far as I'm concerned, is that there still doesn't definitively say anything. In fact, did happen too, right? I mean, it's just pretty much kind of like this is what happened, and
Right.
it might be this, and it might be that. Nothing definitive. So if you're looking for something definitive, folks, this report doesn't give you anything definitive, and
And
I don't
that's
care.
a lot of words for nothing more definitive.
Right. I mean, it's
And
32
then,
pages long.
I do want to bring up, let's say they stay undecided. Well, you know what that means? It should be undetermined, not a suicide. So
Exactly.
wavering or having this much sort of being on the fence, if you will, in the description, and then coming back to it's definitely a suicide seems very disjointed to me.
Yeah, and there's, like I said, just from I could do like a half-hour show just on the things that the police didn't do on this.
Yeah,
I mean,
that's a separate issue. Yeah.
yeah, that is definitely a separate issue. The medical examiner also made a good effort to try to dispel any of this frenzied attack. That like if you look at it, is on page 24. It says the blood evidence at the scene is not consistent with that of a frenzied attack with rapidly repeated stabs. This is because there was minimal blood found at the level of the kitchen countertop by the MEO investigator and by police who responded that evening. This opinion is supported by the injuries noted at autopsy. See findings in autopsy below. Dr. Wayne Ross, who consulted on the case, similarly found no evidence of a frenzied or rapidly occurring attack. So I think that was the effort there to say that this isn't a homicide because it would have been all kinds of craziness going on.
I don't know. Yeah. I don't know. It's not something that I've ever commented on. I'm not a
I
blood
thought that was a
splatter
little
expert.
odd.
Yeah, I'm
I
not a
thought it
blood
was a little odd.
splatter expert. I can look at it and get a general sense. But to me, the body and the interpretation of the wounds is my area of expertise in the toxicology. So I'm gonna limit my opinion to that.
Yeah, I hear you. Well, Dr. Priya, as usual, this was phenomenal. We gave us a master class and everything. I got to go back in this now and do all the quiz questions. So
Oh,
everybody
okay.
in here,
Well,
yeah,
I'm
they
not
got it.
responsible for those. Okay, so
Well, technically
anybody.
you are.
Uh-oh. Uh-oh. I
So
have
you
no.
don't have to
I'm
write
not
them.
grading anybody.
You don't have to write them or grade them, but
Yeah.
you'll be. So if people start sending you hate mail because you got a couple of their questions wrong.
Oh no. Okay.
All right,
I have
Priya,
my
you hang out.
11-year-old's homework to worry about. Trust me.
Tell everybody on the audience where they can find you. Tell us where, if they're interested
Oh
in learning
wow.
more about you.
So my business is Anchor Forensic Pathology, and my email is autopsymd@gmail.com. And I am slowly starting a Facebook page called Dr. Priya Forensic Pathologist. And then I'm working on trying to get a TikTok too, because I think a lot of people just need to understand the basics before they get thrown off the wrong course. And I love to teach. So when that pops up, I will add it to the mix. And then I'm also a little bit on Twitter as well, or X now, autopsy_MD.
Yeah, just from what my experience is, a lot of people like the quiz type of thing where they learn.
Yeah.
So I think that might be something. And you could do that easily on TikTok
On
or
TikTok,
Instagram.
right? Like, what do you make of this? Or A, B, C, D, and Y? Is it, what's
Right.
the
Or
answer?
ask a
So
question, do a 5-second countdown, and then,
that's
there's
great.
lots of
That's a
different
cool
things.
idea. Maybe I will.
Sounds
All
like a
right.
plan. All right. Priya, you hang out 1 second. We're going to say goodbye to everybody else. Guys, thank you very much for the donations and the memberships. I really appreciate that. All the new members, go over to all your members' perks and take a look at them. Thank you, guys. Enjoy the rest of your weekend.